Namaste Vidya. I'm JV'n Doctor, Dr. SUMAN SHEKHAWAT, Department of Ayurveda, Faculty of Ayurvedic Sciences, JYOTI Vidyapeeth Women's University, Jaipur. Today we will discuss on water and electrolyte imbalance. That what is, what happens when electrolyte imbalance occurs in our body? What kind of signs and symptoms we feel or we suffer from when water electrolyte imbalance occurs in a body. In the series of water and electrolyte imbalance, first of all, what is how much water contains? How much water contains in is essential for our life, and how much water contains is in our how much water contains we have 60% to 90% of these are used in most life forms. Two-thirds intracellular fluid and one-third extracellular fluid. Plasma, lymph, interstitial fluid, and blood. That there are water present in our body. That what is fluid imbalance? Dehydration occurs when food loss exceeds intake and sweating. Fluid loss mostly from ECF, extracellular fluid. Most of fluid loss in the form of fluid loss is from extracellular fluid. Decreased circulating blood volume, inadequate tissue perfusion, inefficient transport of substrate to muscle, and elevated heart rate. In the series of fluid imbalance, clinical signs are persistent elevation of heart rate and respiratory rate, weak pulse, poor capillary refill, muscular weakness, tremor, depression, muscle cramps. Treatment of fluid imbalance is IV or oral fluid and electrolytes. Estimate for fluid loss. Weight animal before and after exercise. 1 kg equal to 1 liter. Loss of 2 to 3% of body weight. Reduced performance. And loss of 10% of body weight. Serious, possibly life-threatening. Detecting dehydration, skin pinch test for that instantly normal, 2 to 3 second moderate, and 4 to 6 seconds severe. Capillary refill, press finger on bronze above and upper tooth. हेलो हाँ कौन सा हाँ जी जी स्टाफ कौन जी 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 हम्म 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 हम्म। अच्छा बच्चों को बनानी है सारी फैकल्टी मेंबर्स की और वो अलॉटेड है ओके जी ओके और देनी कब तक है आज ही कब तक हाँ मतलब 2 बजे आते हैं फिर वो खाना खाएंगे पौने 4 तक पौने 3 तक यहाँ पहुँचेंगे जी 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 जी। हाँ हाँ। नहीं तो बच्चे वो जो कंपनी का जो डेस्कटॉप तो अपने पास लिमिटेड है, तो सारे बच्चे बना पाएंगे टैबलेट? अच्छा ठीक है। कंप्यूटर लैब। हाँ 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 जी जी जी। हाँ समझ गई मैं जी। विलेजर्स का। अच्छा मर्ज करना है उसके बाद। ओके। जी जी जी। हाँ हाँ हाँ। जी जी जी। हम्म हम्म। नहीं बीएसएमएस का भी इंक्लूड करना है? हाँ बीएमएस में हाँ, ठीक है जी। और विलेजेस के लिए? जी। हाँ हाँ जी। अच्छा टॉपिक क्या है? हाँ हाँ हाँ। अच्छा अच्छा। जी हाँ। ठीक है ठीक है। हम्म। ओके ठीक है ठीक है ठीक ठीक। जी। फॉर्मेट तो पहले से ही बनाया हुआ है ना, पहले से ही जैसे विलेजेस के इसमें आपको फॉर्मेट दिया ठीक है। हाँ 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 हाँ। नहीं मैं समझ गई आपकी बात की। नहीं 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 वो नहीं नहीं जैसे हर बच ऐसे नहीं आप एक बार मेरी नहीं नहीं मेरी बात सुन लो, बात नहीं। जैसे फॉर्मेट एक होगा जो विलेजर का हमने बनाया ना, उसके अंदर भी तो हमने उसका नाम एज उसका। हाँ जी ठीक है जी जी। एक मिनट एक मिनट। हाँ हाँ हाँ, जी एक मिनट। हाँ अब बताओ। इंटरनल एनरोलमेंट नंबर है। वो मेरे को उसका कुछ पता नहीं है, वो प्रॉब्लम है। अच्छा वो मर्ज कर देंगे क्या? ऐसे तो मेरे पास कई सारे बने हुए हैं। हाँ एक सिस्टम से रिलेटेड टॉपिक हो जाएंगे ना, टॉपिक से ब्रोंकाइटिस के 30 मिनट का वीडियो कैसे बनेगा? कम से कम ब्रोंकाइटिस निमोनिया दो टॉपिक होंगे तब पहले 30 मिनट का वीडियो बनेगा, ब्रोंकाइटिस 15 मिनट में खत्म कर सकते वीडियो में। इंटरनल हो गया, एनरोलमेंट नंबर हो गया, उसके बाद में अपना 3 मंथ में जी। हाँ 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 जी हाँ 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 जी हाँ हाँ ठीक है हाँ अच्छा हाँ नहीं जैसे डॉक्टर तो भी ऐसे जिस डिपार्टमेंट में जो चल रही है वही एसोसिएट होगा ना, है ना? ठीक है ठीक है। तो ऐसे तो फिर वो हाँ जी हाँ सर। जी। हम्म, जी। हम्म, 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 एक मिनट में नहीं है, गवर्नमेंट हॉस्पिटल में बोलना। हम्म, ठीक है। ठीक है। हम्म, अच्छा। इसमें डिजीज नहीं पढ़ना बच्चों को ना। अच्छा। ओके। हाँ हाँ हाँ। जी जी जी। हाँ हाँ जी जी। है ना, विलेजर का नेम हो गया, उसका जेंडर हो गया, उसका एज हो गया और विलेज नेम हो गया ना। जी। और आप फिर भी बहुत कुछ याद है सर, हम तो कुछ याद नहीं है। एक मिनट, आज का जो काम था ना वो भी मैं लिख लेती हूँ। अभी मुझे स्टूडेंट को एक फॉर्मेट बनवाना है, ठीक है। नहीं, स्टूडेंट्स को जो आज बनवाना है ना वो मुझे आज के लिए भी स्टूडेंट्स को भेजना है। ये एक फॉर्मेट तो मैं रेडी कर दूँगी, पर आज बच्चों को वहाँ लैब में जाके और जो हमारे यहाँ के जितने भी, हाँ, जितने भी डॉक्टर्स हैं उनका पहले उनका ये डेजिग्नेशन और फ़ोन नंबर उनको लेना है ना, और लिस्ट बनानी है। स्टाफ पूरा स्टाफ। हाँ हाँ, आप मुझे वो लिस्ट दे दीजिए। ठीक है, ठीक है, ठीक है। जी जी। हाँ, वर्ड फाइल सारे 56 स्टूडेंट्स की अलग अलग बनानी है, जिसमें सात से हाथ समझ लेना। नहीं, एक एक तो अलग अलग वर्ड की फाइल बना ली थी, एक एक्सेल बना ली थी, जिससे दोनों चीजें मतलब देता हूँ। ठीक है। हाँ हाँ ठीक है। In the series of SUV food law, blood analysis, PCV and total plasma protein. Right indicates dehydration. If PKB greater than 50% indicates hazardous fluid loss, fluid volume deficit, hypovolemia, and isotonic dehydration. Common causes: urine, vomiting, diarrhea, burns, diuretic therapy, fever, and impaired taste. Impaired thirst. Clinical manifestation: signs and symptoms are weight loss, thirst, changes in pulse rate and BP, weak rapid pulse, decreased urine output, dry mucous membrane, poor skin turgor. Food food management. Mild to moderate dehydration, correct with oral fluid replacement. Oral dehydration therapy, solution containing glucose and electrolytes. Example, Pedialyte, Rehydrolite, and ORS. And IV therapy, type of fluid odor depend on the type of dehydration and the client's cardiovascular status. Fluid volume excess, common causes: congestive cardiac failure, early renal failure, IV therapy, excessive sodium ingestion, and ADH, corticosteroids. Signs and symptoms are increased BP, bounding pulse, difficulty breathing with supine, crackers, drug therapy. Diabetes may be ordered if renal failure is not the cause, restriction of sodium and saline intake, electrolytes. Sodium, most abundant electrolyte in the body, potassium is as essential for normal membrane excitability for the nerve impulse. Chloride regulates osmotic pressure and assists in regulating acid-base balance. Calcium usually combined with phosphorus to form the nasal salt of bone and teeth, promotes nerve impulses and muscle contraction relaxation. Magnesium plays role in carbohydrate and protein metabolism, storage and use of intracellular energy and neural transmission. Important in the functioning of the heart, nerves and muscles. Potassium imbalance. Potassium is the most abundant cation in the cation in the body. 97% is found in the intercellular fluid, also plentiful in the GI tract. Normal extracellular potassium is 3.5 to 5.3. A serum potassium level below 2.5 or above 7 can cause cardiac arrest. 80 to 9% is excreted through the kidney. Function promote conduction and transmission of nerve impulses. Contraction of muscles promote enzyme action, assist in the maintenance of acid test. Food source, veggies, fruits, nuts, and meat. Daily intake of potassium is necessary because it is poorly conserved by body. Causes of hypokalemia, prolonged diuretic therapy, inadequate intake, severe diaphoresis, gastric suctioning, laxative use, vomiting, excess insulin, excess stress, hepatic disease, acute alcoholism, clinical features, anorexia and drowsiness, lethargy, confusion, leg cramp, muscle weakness, hyperreflexia, hypotension, cardiac dysarrhythmia, and polyuria. Some potassium deficit you can see in this image that what happens when potassium deficit occurs. Alkalosis and shallow respiration, irritability, confusion, weakness, arrhythmias, lethargy and cardiac burst, intestinal mortality, decreased fluid in the हो जाते हैं. IV or PO replacement. PO with 8 or fluid. 8 doses of fluid. Give potassium IV diluted in a large vein. Now push potassium ion as regular. Monitor site for infiltration. Monitor patient stress. Monitor IO. Monitor EKG. Electrocardiogram. Monitor serum potassium ion. Watch UOP. Watch patients who take digitalis for toxicity. Teach family and patients dietary changes. Hyperkalemia greater than 5 EKG, electrocardiogram changes, decreased pH. Result form impaired renal function, metabolic acidosis, acts as myocardial depression and decreased heart rate, cardiac output, muscle weakness, and GI hyperactivity. Causes increased dietary intake, excessive administration of potassium ion, excessive use of salt substitutes, widespread cell damage, burns, and trauma, administration of large quantity of blood, that is called hyponatremia and renal failure. You can see in that what kind of symptoms you feel when hyperkalemia occurs: muscle cramp, weakness and paralysis, drowsiness, decreased breathing, electrocardiogram changes, dysarrhythmias, abdominal cramping, diarrhea, and oligouria. Signs and symptoms: apathy, including numbness and paresthesia of extremities, abdominal cramp, nausea, flaccid muscles, diarrhea, oliguria, bradycardia, and cardiac arrest. Treatment: monitor patients at risk, cardiac monitoring, monitor pulse rate and rhythms and breathing, access for hyperactive vowel sounds, access sensory and motor functions, monitor neurological status, medications, and calcium gluconate IV may be used as an antidote. B50W and regular insulin to facilitate movement in the cell. Administer deoxyrate, oral and rectal, and dialysis. Sodium and fluoride imbalance. Regulated by the kidney, influenced by the hormone aldosterone. Sodium is responsible for water retention and serum osmolarity levels. Fluoride ion frequently appears with the sodium ion. Normal sodium is 135 to 145 milliliters per liter. Fluoride is 95 to 108 milliliters per liter, and sodium and fluoride are concentrated in extracellular fluid. Functions of sodium: transmission and conduction of nerve impulses responsible for osmolarity of vascular fluid, regulation of body fluid level, sodium shift into cell, and potassium shift out of cell. Sodium pump assist with regulation of acid-base balance by combining with fluoride and HCO3 to regulate the balance. Found in extracellular fluid, changes in the serum osmolarity goes with sodium and retention of water, assist with regulation of acid-base value. Fluoride combines with hydrogen to form hydrochloric acid in the stomach. High sodium: the corn and corned beef, potatoes, chips and pickles, liva, soda crackers, tomatoes, beef cubes, and decaffeinated coffee, low sodium fruits, fresh and frozen canned food, and unsalted grains, these like pasta, groceries, and popcorn, wheat, fresh meat. Causes of hyponatremia: prolonged diuretic therapy, excessive diaphoresis, insufficient sodium intake, GI loss, suctional lymphatic vomiting, administration of hypotonic fluids, compulsive water drinking, labor induction with oxytocin, cystic fibrosis, alcoholism. Clinical symptoms: headache, stiffness, confusion, muscle cramps, increasing weight, convulsions. Treatment: restrict food, monitor, yes, monitor serum sodium level, IV normal saline and lactated ringo. If sodium is below 115 milliliters per liter and hypertonic saline is ordered, may give a diuretic for increasing F2 loss, encourage a balanced diet. Safety for weakness or confusion. anemia, dietary access, inadequate VDH, some drugs, hypotonic food to feeding, and major burn. Signs and symptoms of hypernatremia like thirst, flush skin, dry mucous membrane, low leukotriene, tachycardia, fever, hyperactive, hyperactive deep tendon reflexes. Treatment: low sodium diet may use salt substitute, is ration plus okay, encourage active consumption, and monitor food intake on patients with heart or renal disease. Observe changes in BP and heart rate if hypovolemic. Monitor serum sodium level, assist respiratory drug levels, and weight gain. Assist skin and mucous membrane, assist with oral hygiene, and check neurological status. Teach patient to monitor ATO and watch for edema. Teach patients and family signs and symptoms when to report them. Safety precautions. Calcium. Regulated by the parathyroid gland. Parathyroid hormone helps with calcium retention and phosphate excretion through the kidney. Promote calcium absorption in the intestine. Help mobilize calcium from the bone. Surgically induced hypoparathyroidism, renal failure, vitamin D deficiency, inadequate exposure to UV rays, and acute pancreatitis, hyperphosphatemia, signs and symptoms of calcium imbalance like muscle cramp, hyperactive deep tendon reflexes, paresthesia of finger, toes, and feet, tetany, positive Gaucher sign, and Toschi sign, laryngeal spasm, confusion, memory loss, cardiac dysarrhythmia. Treatment: assist clients with surgery and transfusion, fever suppression, and administer IV calcium slowly. Watch for infiltration. Keep calcium gluconate at bedside. Assist nutritional intake of calcium. Watch for sensitivity if taking digitalis may cause lead to cardiac arrest. Increased serum level of calcium symptoms are directly related to degree of elevation. Plants with metastatic cancer are especially at risk. Causes: excessive intake, excessive use of antacid with phosphate binding, prolonged immobility, excessive vitamin D intake, hair rise, diabetic cancer, and thyrotoxicosis. Signs and symptoms: muscle weakness, personality changes, nausea and vomiting, extreme thirst, anorexia, constipation, polyuria, pathological fracture, and calcification in the skin and cornea, cardiac arrest. Findings: serum calcium greater than 10.5 mg per deciliter W, and then changes on X-ray, EKG. Treatment: monitor client at risk, immobile, cancer, intervene client early, drink plenty of fluid, 3 to 5 liters to help excrete excess calcium, administer IV, normal saline 200 to 500 per hour if tolerated or for moderate hypocalcemia, administer loop diuretics, administer calcitonin, teach client to avoid dairy products. Excess magnesium loss from renal or GI, insufficient dietary. हाँ है हाँ इसका भी सैटरडे को आज क्या होता है देखो ना एक बार आपसे प्लीज है essential for neuromuscular integration, hypomagnesemia, increased muscle irritability and contractility, causes decreased blood pressure and cardiac dysarrhythmia, often mistaken for hypokalemia, which can occur simultaneously. Causes: excessive dietary intake of calcium and vitamin D, losses from gastric suction, severe nausea, vomiting and diarrhea, pancreatitis, alcoholism, excessive diuretic therapy, administration of food without magnesium, starvation, malabsorption syndrome, ulcerative colitis, hypercalcemia, hypoaldosteronism, high-dose steroid uses, cancer, chemotherapy, sign and symptoms, cardiac dysarrhythmia, hypotension, tremor, tetany, hyperactive deep tendon reflexes, and memory loss, emotional liability, and confusion, hallucination, seizures, serum magnesium level less than 1.5 milliliters per liter, hypocalcemia, and hypokalemia, EKG changes, monitor client at risk, watch for digital toxicity, cardiac monitoring, seizure precaution, treat with oral iron, IV, magnesium salt, monitor urine output, teach patient about food high in magnesium, green vegetables, nuts, beans, and fruits. Hypermagnesemia usually results from renal failure, excessive intake, reduced sedative effort, or neuromuscular joint diminished muscle cell excitability can cause hypotension or cardiac arrest. Causes renal failure, excessive use of magnesium-containing antacids, untreated diabetic ketoacidosis, and hypoadrenalism. Treatment: monitor clients at risk, monitor who is especially BP, access neuromuscular status and cardiac monitoring, be prepared to give calcium gluconate, minimize intake, monitor client at risk, watch for vegetable toxicity, cardiac monitoring, seizure and precaution, treatment with oral IV, IN and magnesium salt, monitor urine output, teach patient about food high in magnesium, green vegetable, nuts, beans and fruits, usually result from renal failure, excessive intake, reduced sedative effect on neuromuscular junction, and diminished muscle cell excitability can cause hypotension and cardiac arrest, causes renal failure, excessive use of magnesium-containing antacids, untreated diabetic ketoacidosis, and hypoadrenalism. Monitor client at risk, monitor VS special BP, and access neuromuscular status, cardiac monitoring, be prepared to give calcium gluconate, minimize intake. Thank you. This session is powered by Super Zero, Jyoti Vidyapeeth Students University, Jaipur. I hope you all are satisfied with this session. If you feel any kind of problem with this session, please mention it in comment box. Thank you. I will resolve it.